If you're experiencing pelvic pain with activities such as intercourse, medical examination, or even inserting a tampon, you may be having an increase in your pelvic floor muscle tension. My name is Rebecca Petrosino. I'm a physical therapist and I'm board certified in orthopedics. Pelvic pain can be experienced in menopause and perimenopausal states due to vaginal tissue atrophy, lack of lubrication due to hormonal changes, and also weakness of the pelvic floor muscles. Vaginismus is a condition where the pelvic floor muscles spasm with any sort of penetration. Your pelvic floor physical therapist will work with you to create a treatment strategy in conjunction with the whole healthcare team, your physician, your obstetrician or gynecologist, a urogynecologist, or a mental health practitioner. When you come to a pelvic floor physical therapist at PTSMC, you will be taken to a private treatment room where we can review your history and do a full assessment of your posture, strength, and pelvic floor. Some of the things that we do in physical therapy are exercises to address pelvic floor muscle strength, pelvic floor muscle flexibility, and very importantly, relaxation exercises to improve your diaphragmatic breathing and to downregulate the nervous system to improve your pelvic floor muscle function. Patients who attend pelvic floor physical therapy for pelvic pain report the ability to return to the activities that they want to do, including sexual intercourse, sitting for work or daily activities, taking care of their children, and returning to the recreation or sports that they love. Seek out your physical therapist or speak to your OBGYN about a referral to pelvic floor physical therapy.